going to kick off our panel on interoperability. We are so excited to be here. This will be a conversation amongst friends. We're going to be talking about the progress that Surescripts and the Network Alliance has made with interoperability and record locator and exchange. And can you tell us a little bit about the patients that you serve, and in particular the challenges that you've seen connecting with other entities and getting information through interoperability efforts?
You know, Cedars-Sinai is probably one of the largest community hospitals in the country, but it's also a quaternary referral center, large academic institution at the same time. So we tend to get a lot of different types of patients referred to us from all over the place, generally with very complex problems and lots of things you got to look out for and make sure that you have all the data in place. As a hospitalist, you know, when you're seeing that patient, you get that call from the emergency room and you want to quickly assess the patient. Obviously, the more data, the better, and the faster you can get that data and all the snapshots that you can gather quickly before you do all that hunting and pecking around the chart, the better.
Our challenge happens that we're in between two large states, and our patients like to travel. And not all of their data is in our system, so when we're taking care of these complex patients, we need access to information, and that's not always in our EMR systems.
It's absolutely true that healthcare is no longer local. That was something we used to say in the early days of all of this, and data has proven over and over again that patients are everywhere, and so are their records and their information. Athena, you've been an early user of Record Locator and Exchange. Tell us a little bit about the experience at Tampa using the service.
RLE has really expanded our interoperability footprint. Patients come in, some possibly unresponsive in our emergency department, and our EMR is auto-querying Record Locator, Surescripts RLE, and immediately comes back with a list of locations where the patient has been. And if we are electronically connected to any of those entities, we can consume the electronic record in a matter of seconds and make clinical decisions based on that information. The information can be reconciled and behave natively within our EMR.
It's very helpful when you can see actual data. One of the ways we've been using this service is to close care gaps for patients who are seen for diabetic eye exams. It's a notorious problem to solve. We don't always get that information, so knowing where the patient's been and finding and actually being able to get that record's been valuable.
Our patients tend to be, you know, again, as I said, pretty sick. They could be in and out of hospitals quite frequently, and between those hospitalizations, they could be seeing a few providers. And so if you miss one of those provider visits, you may be missing kind of a big part of that kind of post-acute care scenario, or, you know, things in between those kind of big admissions. So again, that's been helpful.
Especially with critically sick patients, I've always felt like it's practically a moral issue to put the burden of bringing their data in-house on the part of the patient, and we as the industry need to solve that. So Athena, let's talk a little bit about the rallying about that is occurring with Record Locator Exchange and care quality.
We've implemented multiple platforms for exchange, but it wasn't really until we connected with RLE that we have essentially removed the blindfold. And we have, since the 7 months that we have been live, we have seen an average 15% increase in established links with external sources. And so what that translates to is approximately 9 million external sources that we have linked with, and that is across close to 9,000 zip codes. It's definitely expanded our interoperability footprint, but we're still not done.
We're never done when it comes to this stuff. So we'll build it out, we'll improve, and we'll keep tackling all of this. Many of our customers have invited us into their health systems, into their homes. We've been able to walk the hallways, talk to physicians, and understand stories of how they're using the service. And it really just brings a tremendous amount of meaning to the organization here and what we're trying to do in serving providers that are the finest in the country, and bringing consumers and patients what is a moral issue to them to have this taken care of by the industry, and instead of their notepads and their 3-ring binders that we've seen all too often carted around doctor to doctor.